Well, hello everyone. This is another episode of On a Bridge MD. I'm Dr. Isabelle Amig, your friendly rheumatologist and host for this podcast. And today I am so excited to have Susannah Kerwin, who is a holistic nurse practitioner. And we recently shared our views on what health means for us. And I had so much shared interest and shared vision that I asked Susannah to come on the podcast. So without further ado, Susannah, thank you so much for being here. And you have such a cool story. I would just like you to start and tell us how you found yourself in Denver, how you found yourself being a holistic nurse practitioner. Tell us about it.
Thank you. I'm so happy to be here. Fun to chat with you. Let's see. So I feel like I came to holistic nursing and holistic medicine from a young age. I really was interested in nutrition as a teenager even. And it probably started just like, any teenager being concerned about my skin, right? I had some acne and I really wanted to find out what was going on, like what was causing it. And it kind of led me to change my diet up and eat more plant-based at that time. I think I was 17 years old and I had met a woman who was raising her child as a vegan. And at that time, to me, that was very interesting and different, right? And I had never thought about that, never heard about that before. And then fast forward to, college, I decided to go the nursing route because I felt like there was a lot of opportunity there for education for myself, for my patients, and kind of to use that lifestyle medicine that at that time, it wasn't being called that at all. But it was really important to the nursing framework, right? To like learn about a patient's stress, a patient's diet, a patient's movement, and what they were doing just on their daily basis. That's part of the nursing perspective. And then as I got further into my career, I worked in several different areas. I worked in mental health for a number of years in San Francisco. And then I ended up moving to New York to work in the operating room. So kind of a huge shift from working in psychiatry, right? So like we're doing a lot of like very hands-on stuff. And of course I was part of a team approach, which I really, really loved. So it kind of opened my eyes to where I wanted to be, like somewhere in between all of that, right? Like putting those worlds together. So I pursued my master's degree in nursing, and I was in a holistic program at NYU. And let's see, at NYU, we were able to explore our own interests even through this program. So I had developed an interest in clinical hypnosis, actually.
Oh, that's so cool. I love this. I think that's fascinating. We had a physician hypnotist on the podcast. It's
oh, cool.
Yeah. It's I love it. I think it's so cool. Yeah.
Yes. And I think to me now, like I tried to incorporate it into an early practice when I was a young nurse practitioner working in primary care. And the physician that I worked for, he was very open to it. He's like, sure, you can try it with patients. And I helped a few patients with smoking cessation and even like weight loss issues and just anxiety, right? And so to me, it just put my mind thinking about language and how powerful language can be. And when you're working with people, what you say really does matter, and how you use those words. Because
absolutely, this is funny. Like I had a full episode just on that, the power of the words. Yeah. I mean, it's so important. It's so important. You're absolutely correct. So important.
And I think that when patients come into the office, like to your office, to my office, to wherever they're being seen, they actually are in a state of kind of like self-hypnosis because they might be scared. They're very focused on what their thoughts are maybe, and they're not noticing what's going on around them. So it's interesting because sometimes you'll hear from patients like, oh, they didn't tell me this or they didn't tell me that. And it's possible they missed a lot of it. So I think that's where it comes in, like in your practice and in my practice, where we see patients multiple times and we have that relationship and we're available, and it's super, super important to be able to like reiterate things that you want to work on with patients.
Mm-hmm.
I'm trying to think what else.
So then you were in a primary care physician office. You were doing a little bit of hypnosis. And so tell us how you got into integrative medicine and how you decided to basically go on your own.
Yes. Yeah. So as I grew in the practice, the MD hired me to do women's health there. So I was actually seeing a lot of women for, standard primary care, pap smears, birth control, dealing with any concern that would come up for women. And I just kind of like started layering in some of these approaches that I had learned from my experience in school. And then once you learn one thing, you just want to add more to it. So I started getting more education through the Institute for Functional Medicine and trying to work that into the practice. And I feel like it was moderately successful, meaning that I did have a lot of patients who were open to it, a lot of highly educated patients who, had the means to be able to buy some of the supplements and whatnot. But it was hard because we were limited by the time that we had together. So with short appointments and also not really being in control of like what I could order for patients, as far as labs were concerned, I found that to be after a while a bit stifling and just like sad, because I knew that some patients could benefit from additional testing, right? They'd come in, they would have standard workup, everything looks normal. See you later. That is not so fun for them or I think for me. And once the pandemic hit New York City, which was where I was living at the time and practicing, I just really realized that I could, it kind of made me reevaluate life in a way. It's like, here's this global pandemic happening. Do I really want to be practicing in this way? Or do I want to be following my own passion and feeling like I can really help people with the knowledge that I had gained? So that's when I started my own practice, which I called Tendwell. And yeah. And then a year later, I moved to Denver, Colorado, mostly because of our family, just to have more space. And I have 2 kids, and it's so pretty here, and it's a little bit closer to where I'm from, which is California. So I feel like an in-between vibe between New York and California, I think.
It's funny because I also moved from New York to Colorado. I absolutely adore Denver. I'm just such a fan. What is the difference between the patients that you used to see in New York and the ones that you are seeing in Colorado? Like, what's the main thing that you've seen that are different?
That's a good question. I feel like there is actually a lot of similarities between the patients, but a lot of people here are more active and they're more interested in being outdoors and have kind of outdoorsy hobbies, which are not what I would see in New York as often.
Yeah, no, that's interesting. So like my auditors know that I like to use the word of zone of genius. I feel like all of us have a zone of genius. And when it comes to health, as health practitioners, we also have a zone of genius, which is this zone where we feel that when the patients comes and you're like, oh my gosh, I know I can help. I know I can help. I know I can help. Please let me help you. And so what would you say is your zone of genius? And I really like this word, but some people are like, what do you mean zone of genius? I'm not a genius. But yeah, we all have a zone of genius. I really do think so.
I know. I think it's hard for people, myself included, to like sing your own praises, right? That's like some psychology around that. But yes, I really like working with women in general. I see a lot of women and I feel comfortable, with all patients, but it does seem like I get excited when I see patients who are I'm not excited for their struggle, but when they have concerns about, fertility or concerns about hormonal issues, I really am excited to like work and dive deep with them, because I know from my previous experience working in more of like the primary care women's health sphere and, you know, referring a lot of people to OBGYNs, it's just that, first of all, OBGYNs are very busy. So they see a certain group of people. And if you do not have something that needs surgery, or you're not about to have a baby, or you don't want to take birth control pills, then you may not be getting your questions answered, or nobody's tending to what you need. And even just like basic hormonal workup, as far as just like a standard workup, it's not going to give you that much information. So I like using more of the functional medicine tests, like a Dutch test from Precision Analytical, to kind of look at the overall picture. Like, how are you metabolizing your estrogen? What is actually happening there with your progesterone? What's happening throughout the cycle? We might get like a cycle mapping test where we see every day of your cycle, and that gives us a much fuller picture, in addition to getting like serum testing for progesterone or some testosterone and DHEA and things like that you can get. But I really feel like that's an area that is sorely missing help for just regular women, you know.
Mm-hmm.
And that could be anywhere from like a 30-year-old to like 55 years old, like kind of in this span of like when your hormones are potentially changing, and you know, we can intervene with food, with supplements, and our habits.
And that's actually a very good segue. Can you tell us a little bit what functional medicine is? Because I mean, I think that we didn't hear how you got there. How did you get to functional medicine, and what is it?
Yes. You know, I was thinking about this recently, because even when we were talking about integrative medicine and like functional medicine, and there's holistic medicine. Like, what is the difference? And I think really it's the connectivity that, like, with functional medicine, it's that, you know, we're looking for the root cause and everything is connected. And basically there could be one dysfunctional process that's happening, or there could be multiple. It could cause one thing to happen, or it could cause many things to happen, right? So it's kind of like, I don't know, that sounds kind of ambiguous, but like I had a patient the other day who, it turns out his insulin was high, right? He has high insulin, and that is a very common driver for dysfunction, right? He's overweight, he had low testosterone, like it's driving a lot of the things that are plaguing him, fatigue, and he had an autoimmune condition that developed, right? Because of all this chronic stress was probably part of that picture too. But it's just looking at all of those layers and pulling it all together, you know?
Mm-hmm. So functional medicine is integrative.
I would say, to me, it is. I mean, I think the branding is weird, honestly. Like, I think to me, it is integrative medicine. It's functional medicine's holistic. You're looking at the whole picture. You're looking for root causes. You're tying it all together. You're not eliminating one thing. You know, it's true. Like I had another patient yesterday who the reason why she was seeking fuller care is that she has a new autoimmune diagnosis, and it's very compartmentalized. Like, she's going to see an endocrinologist, she's going to see a rheumatologist, and not a rheumatologist like you, who's, well, I don't know, maybe she will see you. But I think like somebody who is less likely to really look at that full picture. They're like, oh, you know, like you have a positive ANA, but everything else is negative. Bye. But I think that happens a lot in like standard rheumatology. What would you say?
Yeah, I mean, you know, Hashimoto can have a positive ANA by itself. So if you have, like, having an ANA by itself doesn't make a rheumatologic disorder. And the truth is that if you have Hashimoto, or if you have, you know, one of those autoimmune thyroid disorder, you can have a positive ANA, and that can be it. Yep. Now, that said, when you have one autoimmune disorder, you can have several. So it comes in clusters. And so I think it's actually really important to consider that first autoimmune disorder as the possibility of like sort of a window to see if there's a possibility of a second autoimmune disorder, or third, really. And really looking at those patients with, like really like holistically and really well, because it's so easy if you just have a couple of minutes to say, oh, this is just your autoimmune from your thyroid, and fix the thyroid. If it doesn't get better, just come back. That's in the best case scenario. Most of the time it's like, it's your thyroid, bye. And I just feel like, okay, well, do you have rheumatologic disorder in your family? Do you have any other symptoms? Like, is it just fatigue and weight gain or weight loss, or and depression, and or is there any sort of symptoms that could be related to rheumatologic disorders? And I think then you want to go deeper, and then you want to make sure that you follow up with them, just to make sure, right, like that everything is controlled. And if there is a first like autoimmune disorder, you really don't want to miss a second one. Because right, like the thyroid disorders are treated with just replacing thyroid treatment. But if there is another rheumatologic disorders, you want to actually maybe use immunomodulators that are not necessarily immunosuppressive, but that are immunomodulator. And you may not need an immunosuppressive if you're able to get on time and make sure that it's just immunomodulator. So to me, there's a window of opportunity in those patients that we should actually look at. So yeah, that's my thought. Usually I ask the question.
Sorry, just curious. And also, like, that's what I love anyway. It's like, I love learning from other people. And I also love like working with others, because I think it does take a team approach, sometimes, for whatever reason. I mean, I think that's like typically how I get a lot of patients, because they are seeing a specialist, and then the specialist, they don't feel like they're getting enough of the answers that they need. And so then I end up seeing them too, which is fine, because I would rather work with people and have them do the specialty. And then I kind of like add on all those other things. And we have the time to do it.
Totally. So, Susannah, we are coming to the end of our discussion, and I'd like to ask you, so this podcast is about hope driven by science. Tell us a story where you felt, this is exactly like it embodies this, say, hope driven by science. Tell us a story of hope.
A story of hope. Well, I mean, one that comes to mind, which is kind of a personal story for about my own one of my kids, is that, ironically, maybe she had developed a really scary reaction to a strep bacterium when she was in second grade. And it was interesting, it was terrifying from a parental point of view, but it was very interesting from a medical point of view, because basically I was like, oh, wow, this is what my patients are dealing with sometimes, like getting a diagnosis that's a little bit considered on the fringe. She was actually diagnosed with PANDAS, which is a neuropsych disorder that a person can develop, mostly kids, after exposure to strep. And you know how common strep infections are in children. So she had developed like sudden onset OCD and just a lot of like really scary stuff. And then when we went to see her pediatrician, who was great, she agreed it might be this PANDAS diagnosis, but she didn't know what to do about it. And there wasn't a lot of answers. And here we are in New York City, like there's the most amazing medical community there. And it was very hard to find a doctor that dealt with it. And we were lucky, we ended up seeing someone, and she was put on a lot of antibiotics to treat this. And they were also looking other directions. Like they also had her on antihistamine, and some of that was to bring down inflammation in her brain. And like, I had to like go deep myself, because I wanted to make sure that we weren't missing things. And also to have your child on long-term antibiotic therapy, it's very scary. You don't want to destroy their microbiome. They're still forming, they're still growing. And ultimately I had to make this tough choice and basically find a surgeon who would be willing to take out her tonsils, even though she had never really had a history of like, overly large tonsils or like super infected tonsils. But once she had her tonsils removed, everything went away. Like she was able to recover and like be completely happy, and you know, hasn't ever had that happen again. But it was a year of our life, like a little more than a year of dealing with that. And I can't really imagine I can imagine. I feel like it's very scary, especially for people who don't have that medical background and how to navigate that system. And it really inspired me to want to help other people who have a similar situation like that. Maybe not PANDAS, but like other chronic issues that haven't had that similar holistic approach.
That's very interesting. So basically being the patient, the advocate in this case of your daughter, and look at the literature and just realize that maybe the tonsils had to be removed because there's not that much studies on PANDAS, and then realizing that may be the answer, and have that surgeon being able to do this. I think that's actually really cool, because you're looking elsewhere and you're looking at the science, but you're looking sort of off the beaten path, which I think is really important. That's how we find new studies. That's how we find new answers. And, you know, that is how what we call rare disease find treatment, because there's much less money poured into those rare disease, but there are still a lot of patients with those rare diseases, and they form association, organization, and then they basically talk to each other and they find answers. And it might not work, and it's not exactly the same process than regular science where we do randomized control trial and all this, but it's also super important because experiences is how we used to do medicine in the past. And yes, it's not perfect, but it's better than nothing. And I think that that's super important as well, to be open to those. So where can we find you?
Well, you can find me online at tendwellhealth.com, and my office is in Cherry Creek. And yeah, that's it. Yeah. And you can find me on Instagram too at Susannah Kerwin NP. But I look forward to meeting anyone. And this was so fun. Thanks for organizing it.
Yeah, you bet. Well, it's my pleasure. Well, I'm going to just say thank you, everyone, for listening. If you are looking for a holistic nurse practitioner with some functional medicine background, don't hesitate to look at Susannah Kerwin at Tendwell and on our website, and we will have all of those in the notes. And if you are looking for rheumatologist in Colorado, you know that where you can find me. I just want to say in advance, we are about to increase our prices. So if you want to take advantage of our founder's price, it's been about 8 months. And so those are founder's price. Take the opportunity right now, because we are about to increase those prices very soon. Right. Well, thank you, everyone, and see you next week. Bye-bye.